Okay, immunology for the second part of the video, clinical science. You need to know the types of hypersensitivity. So types of hypersensitivity, type 1 is anaphylactic, when basically what happens is when there's an allergic reaction, that's when this happens. Antigen reacts with IgE bound to the mast cells. So the antigens, the allergen antigens react with IgE that are bound to mast cells. So anaphylaxis, atopy happens. That is type 1, anaphylactic asthma. Just remember AA, asthma. Type 2, cell bound. Now this one is cell bound. It's not IgE. IgG or IgM binds to antigen on the cell surface. So it's about the cell. Example would be autoimmune hemolytic anemia, like IgG or IgM binds to the red blood cell, the antigen on the red blood cell, and destroys it. ITP and Goodpasture syndrome. Type 3 would be immune complex, like a complex of antigen and antibody forms, and that's what causes the problem. Like free antigen and antibody combined, IgG, IgA. Examples are serum sickness, SLE, very important. Post-streptococcal glomerulonephritis, extrinsic allergic alveolitis, especially acute phase. Type 4 would be T cell mediated, tuberculosis, tuberculin skin reaction, graft versus host disease, allergic contact, dermatitis, scabies, extrinsic allergic alveolitis, especially chronic phase. Type 5 is stimulated hypersensitivity, that is like IgG antibodies stimulate cells that they are directed against. Graves and myasthenia gravis are example. Okay, allergic test. There are two types. In fact, there are three types. Skin prick test, most common, easy to perform, and inexpensive, not very expensive. Drops of diluted allergen are placed on the skin, then skin is pierced using a needle. Many allergens can be tested at once. That's the advantage. Normally includes a histamine positive and sterile water negative control. A wheal typically develops if a patient has an allergy. Can be interpreted after 15 minutes. Useful for food allergies, pollen, and wasp bee venom. Skin patch testing, that's another way. Skin prick. For use for food allergies, pollen, and wasp bee venom, very important. Skin patch testing, this one will be for many antigens. It's useful. Skin patch testing useful for contact dermatitis, you have to remember. Around 30 to 40 allergens are placed on the back. Irritants may also be tested for. The results are given in 48 hours, later by a dermatologist. So it takes time. This one is easier, 15 minutes, and this takes time. Another one is radio RAST test, as in radio allergosorbent test. Determines the amount of IgE that reacts specifically with suspected or known allergens. For example, IgE to egg protein. Results are given in grades from 0 to 6, negative to strongly positive. So amounts of IgE that react specifically with suspected or known allergens, for example, IgE to egg protein. Results are given in 0 to 6. So this is also important. This is like useful for food allergies, inhaled allergens, and wasp bee. Blood tests may be used when skin prick tests are not suitable. For example, if there is extensive eczema or if the patient is taking antihistamines. Okay. Next will be immunoglobulins, very important as well. Immunoglobulins are basically antibodies, right? And known as immunoglobulins Ig, are large Y-shaped proteins produced mainly by plasma cells. Very important. Used by immune system to neutralize pathogens like bacteria and virus. So there are 5 types of immunoglobulins. First one is IgG. That is the most important one, 75%. It's a monomer, enhance phagocytosis of bacteria and virus. So enhance this phagocytosis of bacteria and virus, like engulfs the bacteria and virus by neutrophils. IgA, 15% monoblast dimer, found in secretions. So A is for secretion, provides localized protection on mucous membranes. Okay, IgM, 10% pentamer, first to be secreted in a reaction, in an infection. First to be secreted, anti-A and B blood antibodies. So blood transfusion reactions, that's where IgM comes up. IgD, monomer, 1%, involved in activation of B cells, and Ig is monomer involved in allergic reactions. So in each day, an average adult produces 3 gram of antibodies, and 2/3 of this is IgA. So IgA is like the most produced antibodies. That's something you have to remember. The majority is produced in association with mucosal membranes. IgG remains the most common antibody in circulation with 35%. So that's in circulation. So this is circulation, but in majority, IgA wins. But in circulation, IgG is the one with 75% coverage. Okay, so we go in details with these IgG, IgM, all these immunoglobulins. So first one is IgM, that is the one which is like the first to be secreted. So IgM is 10% of the serum antibodies and is the first antibody produced during an immune response. So half-life is 5 days. So it's like 5 days half-life. IgM, as we know, is first to be secreted. Pentamar has 10 epitope pair binding sites. Fc portion of IgM can activate the classical complement pathway. Okay, most efficient. Monomeric IgM are found on the surface of B lymphocytes as B cell receptor or SLG. IgD not like very much into action. That helps in activation of B cell. So it's 1%. Monomer has 2 epitope binding site found on the surface of B lymphocytes. Important to know. Along with the monomeric IgM as a B cell receptor, where it may control B lymphocyte activation and suppression. IgD may play a role in eliminating B lymphocytes, generating self-reactive autoantibodies. It may help. Most important, IgG. IgG is 75% of the serum antibodies, half-life of 7 to 23 days, depending on the subclass. Monomer has 2 epitope binding site. The Fc portion of IgG can activate the classical complement pathway like IgM, and Fc portion of IgG can bind to macrophage and neutrophils for enhanced phagocytosis, as we have studied previously. The Fc portion of the IgG can bind to natural killer cell for antibody-dependent cytotoxicity. So many use of the Fc portion. The only class of antibody that can cross the placenta and enter the fetal circulation, that's IgG. Okay, IgA, 15% of the serum antibody, half-life is of 5 days. Mainly in the body secretions, as you know, saliva, mucus tears, colostrum, and milk as secretory IgA, where it protects internal body surface exposed to the environment, blocking the attachment of microbes. Secretory IgA is the most immunoglobulin produced, but it's not in circulation, as we have said before. IgA is made primarily in the mucosal associated lymphoid tissue, mouth tissue. The Fc portion of secretory IgA binds to components of mucus and contributes to the ability of mucus to trap microbes. So it's very important. So it binds to components of mucus and helps to trap microbes. IgA can activate the alternative complement pathway. A alternative. Okay, then IgE is another set. It's 0.002% of the serum antibodies with a half-life of 2 days. Most IgE is tightly bound to basophils and mast cells via its Fc margin. So tightly bound to mast cells as well. Monomer and has 2 epitope binding sites made in response to parasitic worms. Oh, okay, this is very important. Made in response to parasitic worms and arthropods, often made in response to allergens. IgE may protect external mucosal surface by promoting inflammation, enabling IgG, complement proteins, and leukocytes to enter the tissues. The Fc portion of IgE can bind to mast cell and basophil, where it mediates many allergic reactions. Cross-linking of cell-bound IgE by antigen triggers the release of vasodilator for inflammatory response. The Fc portion of IgE made against parasitic worms and arthropods can bind to eosinophilic, enabling opsonizations. So important for parasitic infections or allergy components. Okay, so the primary immune deficiencies that are there. The primary immune deficiencies are disorders may be classified according to which component of the immune system they affect. So neutrophil disorder is chronic granulomatous disease, Shediac-Higashi syndrome, leukocyte adhesion deficiency. For B cell disorders, there are IgA deficiency, Bruton's congenital agammaglobulinemia, common variable in immunodeficiency. T cell disorder is Dijon syndrome, example of microdeletion syndrome. Patients are consequently at increased risk of viral and fungal infections. Okay, so very important one. Combined B and T cell, severe combined immunodeficiency, ataxic telangiectasia, autosomal recessive, 10% risk of developing malignancy, lymphoma or leukemia, but also non-lymphoid tumors can cause recurrent chest infection. Management is chronic granulomatous disease. Uh, Management of chronic granulomatous disease. Of course, neutrophils are give antibiotics, prevent bacterial infection, interferon immunomodulation, hematopoietic stem cell transplantation, leukocyte addition deficiency, also neutrophil disorder, give do bone marrow transplantation, IgA deficiency, that is from B cell disorder, prevent and treat infections. Common variable immunodeficiency, regular IV immunoglobulins, severe combined immunodeficiency, bone marrow transplantation. From here. And Wiskott-Aldrich syndrome is inherited as an X-linked recessive fashion mutation in the WASP gene. Okay. So features include recurrent bacterial infection like chest infection, eczema, and thrombocytopenia with low IgG. Okay. Coming to a very important topic as well, anti-neutrophilic cytoplasmic antibody, ANCA. It's a group of an autoantibody mainly of the IgG type